Yeah, that was a bit over the top, I'll admit that, but make no mistake, carpal tunnel syndrome is a serious and painful condition. My name is Chad K. Schlesinger, and I should know, as I've had this for over a year now, and despite my best efforts, it's only gotten worse. But as my condition has worsened, my knowledge about it has grown. And I'd like to share some of that knowledge with you in the hope that it can either help you or someone you know. Now, while carpal tunnel syndrome can be caused by what many people consider everyday activities, there are many ways to remedy and perhaps even prevent this condition. Okay, I'll have to. Sorry about that. It's okay. Now, what is carpal tunnel syndrome? Now, according to the Mayo Clinic, CTS is a progressively painful hand and arm condition caused by a pinched nerve in your wrist. Now, the carpal tunnel itself is a narrow tunnel that's formed by the bones and other tissues of your wrist. Now, this tunnel protects what's called your median nerve. That helps you move your thumbs and the first 3 fingers of each hand. Now, the symptoms of carpal tunnel syndrome can include frequent burning, tingling, or itching, as well as numbness in the palm of the hand and the fingers, especially the thumb and index or middle fingers. And symptoms do get progressively worse without treatment, to the point where the pain can be so bad that you can't sleep at night. Now, who gets carpal tunnel syndrome? Now, according to FamilyDoctor.org, women are 3 times more likely to get it simply because of the fact that most women's wrists are smaller. But it's most common in people whose jobs require pinching or gripping with the wrist held bent. However, there are conflicting studies as far as what the primary cause of carpal tunnel is. For example, the Mayo Clinic considers possible causes to be diabetes, thyroid disease, rheumatoid arthritis, and they've even linked carpal tunnel syndrome to pregnancy as well. Also, assembly line workers, people who use computers, musicians, and mechanics can be particularly prone to carpal tunnel. Approximately 1 out of every 20 people has carpal tunnel syndrome. How does it happen? Well, here's a quick diagram. The carpal ligament, which is right here, becomes inflamed for whatever reason, and that pinches the median nerve, which is right here. Now, the median nerve, like most of the nerves in your body, has the consistency of jello. So when something is pressing on this area here, the only thing that can really yield is that nerve, because you have bones which are hard, tendons which are not quite as hard, but still fairly resistant to pressure. But the nerve itself is the only thing that yields to that pressure. And the symptoms tend to begin in the thumb and first 2 fingers. How is it diagnosed? There's a couple of different ways. Physical tests. One of those tests is called the Tinel test, where the doctor either taps on or presses on the median nerve in the wrist. That test shows positive when you either get tingling in the fingers or a shock-like sensation occurs as the doctor is hitting you in the wrist. And there's mechanical testing to confirm the diagnosis. What was done with me personally is what's called a nerve conduction study. And here's a diagram of how that works. You have some recording electrodes which are placed on your upper arm, and then they call it stimulating electrodes. I call it a mini stun gun. That is touched to your fingers itself, so you get a bit of a shock. Now, small electric shocks are applied, and the speed with which the nerves transmit the impulses is measured. It feels like a shock from a home electrical socket, if you've ever accidentally buzzed yourself from one of those, but it lasts a bit longer because they're holding it down for a second or two to confirm it. Now, how can carpal tunnel be treated in the short term? First of all, topical creams. And like Kyle said, Bengay. It can help for a short period of time. Slightly longer are anti-inflammatory drugs, things like ibuprofen or Aleve. Hand or wrist exercises, depending on how early you're diagnosed, can also help by strengthening the tendon itself. Hand or wrist braces, like what I'm wearing here, these particular braces I have to wear all day. They have a metal bar in the bottom of each of them to keep me from pulling my wrist down and to keep it straight. Now, these right here are examples of bigger braces that I have to wear at night. They're longer, they have more padding, they also have a longer metal bar on the bottom. And finally, steroid injections. Steroids are another type of anti-inflammatory drug. And what they do is they down the peripheral area of the wrist and inject it. Don't worry, that's just a picture, not the video. I didn't want to make anybody squeamish about it. However, if you do want to see a video of this, you can go to that website address right there. Now the long-term treatments for carpal tunnel. The most effective long-term treatment is surgery. Now the sites that I've seen use the nice little euphemism of release the carpal ligament. Let's be honest, they're slicing it. They're cutting it to relieve the pressure on the wrist itself. Now usually post-surgery physical therapy is needed, and it can vary as far as the individual how much therapy is needed. Sometimes it's weeks, sometimes it's months. Here's a quick diagram of how they do that. This is under local anesthesia. They basically open it up and release the ligament. And if you actually want to see a video of carpal tunnel surgery, there's a place you can go as well. Now, how can you prevent carpal tunnel syndrome? If you don't have it yet, try not to bend, extend, or twist your hands for long periods of time when doing repetitive tasks. Don't rest your wrists on hard surfaces for long periods of time. Take regular breaks from repeated hand movements to give your hands and wrists time to rest. And if you do use a keyboard a lot, adjust the height of your chair so your forearms are level with the keyboard. This way you don't have to flex your wrists tight. And this has, I can say with personal experience, has helped in my case. Gel wrist rests for mouse pads and keyboards can help considerably because they do rest your wrist, but on something soft as opposed to hard. Now, where can you find out more information about carpal tunnel syndrome? Well, here are the places that I found a lot of information. The National Institute of Health, the Mayo Clinic, and familydoctor.org. I hope you both enjoyed yourselves and also learned something from this presentation. I do want to stress one final thing though. If you or someone you know is experiencing any of the initial symptoms, get to a doctor as soon as you can. Because the earlier carpal tunnel syndrome is diagnosed, the more likely it can be treated effectively without surgery. Thank you for your time.
How long?